This video is going to show you everything that you need to know about plantar fasciitis. We're going to go through what it is, the exercises you can do to help, the do's and don'ts of the condition, and what to do if it doesn't improve. Let's get right into the video. So let's get down to basics. What is the plantar fascia and how does it lead to plantar fasciitis? The plantar fascia is a thick band that essentially connects your heel bone to your foot. Plantar fasciitis was thought to be caused by inflammation of this thick band, but actually recent research has showed that it's due to some breakdown in this banding rather than inflammation. One of the most common symptoms of plantar fasciitis is pain just underneath the heel. This pain is usually about 4 centimeters from the heel bone, and you can usually elicit the pain if you poke the area. Now, there are other symptoms that make your heel pain most likely to be plantar fasciitis. Some of these are if you start walking after a period of resting or sleeping, the pain is usually worse and it gets better as you start moving and exercising. But if you are doing very vigorous exercise, that can exacerbate the pain as well. And patients find that it's difficult to raise their toes off the floor as it stretches that plantar fascia. Similarly, they also find it difficult to go up and down stairs. Now, if you're experiencing heel pain whilst you're resting or at night it wakes you up from sleep, then it is unlikely to be plantar fasciitis and you should speak to your doctor about this. So what are the risk factors that mean that you get plantar fasciitis? Now, we've spoken about it as being a thick band that connects the heel bone to the rest of your foot, and anything that can aggravate this band can lead to pain in that area. So things like ill-fitting shoes, being on your feet a lot more than you're usually used to. If you started exercising on a different surface, say for example you were running on a track or a treadmill and you switched to running on the road or a rough surface. And if you have a tight Achilles, this is the tendon that connects the muscles from your calves to your heel bone, as this makes it difficult to flex your foot. Let's now go through the 4 exercises that you can do in the comfort of your own home to help with the pain from plantar fasciitis. The first exercise is to stretch the plantar fascia itself. Now, whilst in a seated position, you can either use a rolling pin, a tennis ball, a drinks can. I've just got a ball from my tumble dryer, and you need to place it under the foot with pain and roll your foot back and forth in all directions for a few minutes or until you feel some discomfort. Ideally, repeat this twice a day. The next exercise is to stretch your Achilles tendon. What you need to do is place your front foot around 30 centimeters from the wall and have it in a bent position. The back leg needs to be straight and the hands need to be at shoulder length. You push forward so that you feel a stretch in the calf of your back leg. Do around 10 mini push-up motions against the wall to stretch and relax that calf muscle. Repeat this exercise twice a day. The next exercise is stair stretches for your Achilles tendon and your plantar fascia. You need to go up onto your step and position your heels so that they are off the end of the step, with your legs slightly apart. Now you lower your heels whilst keeping your knees straight until you feel a tightening in your calf. Hold this position for about 20 to 60 seconds and then raise your heels so that they are back in the neutral position. Repeat this motion 6 times and repeat the exercise itself twice a day. The last exercise I'm going to show you is something that you can do before you get out of bed. Using a towel, place it around your foot like shown and keeping your knee straight, flex your foot. Do this stretch 3 times on each foot. Now, once your plantar fasciitis is diagnosed, it can take up to 6 months to about a year for it to fully resolve. Now, let's get into the important part. What you should and shouldn't do when you have plantar fasciitis. Do rest and raise your foot when you can. Don't use ibuprofen for the first 48 hours from when your plantar fasciitis flares up. This is thought to slow down the healing process. You can use ibuprofen after that 48-hour mark. Do wear footwear with cushioned heels and arch supports, and avoid walking on hard surfaces barefoot. Try doing exercises that don't put pressure on your feet, such as swimming, and if possible, avoid standing and walking for long periods of time. You can use an ice pack in the area covered by a towel for about 20 minutes at a time, 2 to 3 times a day if you find it helpful. And it's important to avoid high heels, pointy shoes, and wearing flip-flops or strapless sandals, as these provide poor support for your foot and arch. If you try these tips and you've noticed there's no improvement, that the pain is getting worse, you notice tingling or numbness in your foot, or if you have diabetes, then it's best to speak to your GP to rule out other causes, if not already done so. If the diagnosis is correct and you do have plantar fasciitis that isn't improving, your GP can refer you to a foot specialist, which is also known as a podiatrist, or to physiotherapy. There you go. That is plantar fasciitis in a nutshell. I will link the NHS guidance in the description for you to read in your own time. Don't forget to subscribe for more health-related content, and I'll see you in another video. Bye.